Our next speaker is Dr. AJAY Kumar Sinha. He will dealing with a case. He is dealing with a case selection in DCR.
Good afternoon, dear delegates. Firstly, I would like to thank our chairman, Dr. Ravi Ranjan, for believing in me and giving me this opportunity. And secondly, I have no financial interest in this presentation. Dear friends, all of us doing DCR surgery must have experienced that the road to a successful DCR is not as smooth as we would have liked. It's really a bumpy one. And that's why today we are here to make this road as smooth as possible. To minimize the failures and make the road a bit smoother, case selection is very important. Now let us remember some guidelines for a successful DCR surgery. Number one, I would like to say that the best sac for doing DCR surgery is the one with a mucoceal. Why? Because the sac is bigger and it will be easier to make the flaps. And number two, the best patient, ठीक है अभी इसी पर है. The best patient for doing DCR is a thin, frail, elderly patient with roomy nostrils. Now, how can we make the road to the DCR smoother? Number one, first and foremost, we will have to differentiate whether this is a case of epiphora or a case of hyperlacrimation. Number two, after we have confirmed that it's a case of epiphora, we will have to evaluate the lacrimal drainage system and establish that the blockage lies somewhere distal to the sac or in the NLD. The sac ka status we'll have to see. Whether the sac is having some functional loss. Nasal pathology, we should exclude nasal pathology, because if this epiphora is because of nasal pathology, then doing DCR will not cure it. So we'll have to treat the nasal part, and then this epiphora will get cured. Let's start from the symptoms, right? Even a simple question कि पानी कहाँ पे, पानी गाल पे चूता है कि नहीं चूता है, this will indicate tears overflowing onto the cheek is likely to indicate drainage failure rather than hypersecretion. The other thing is location of the epiphora. Tears medially or centrally, they indicate epiphora related to nasolacrimal duct obstruction. Apart from this, mucopurulent discharge, matting of the ilices, these all symptoms will be present. Let's move on. Again, laterality and duration. This is important. Let's start our examination. In external examination, let's concentrate first on the punctum. Punctal abnormality is the most common cause of lacrimal drainage failure. But in our case, if this is the cause, DCR is of no use. So we have to choose the patient which is fit for DCR. So we'll have to rule out punctal stenosis, ectropion, any lid pathology, ectropion. This might be causing epiphora, but then DCR won't help. Next, regurgitation test. This is an important test which we do, and regurgitation test of mucopurulent material on compression is indicative of a mucocele with a patent canalicular system, but with an obstruction either at or distal to the lower end. Because if punctal reflex is taking place, this means that the anterior lacrimal drainage system is patent. Again, fluorescent disappearance test. This test, what do we do in this? The fluorescent disappearance test is performed by instilling fluorescent 1 or 2% into the conjunctival fornices. Normally, little or no dye remains after 5 to 10 minutes. But if the dye is still present, that means prolonged retention is indicative of inadequate drainage system. The drainage system is not adequate. So now we have to find out where is the cause. We'll do lacrimal irrigation and probing. We can do with this. Look, last point. If saline passes into the nose and throat, tested by the patient, a patent lacrimal system is present. So the system is patent. Then again, no DCR needed. Probing. While probing, we may get a hard stop or a soft stop. Now, hard stop indicates that the cannula has entered into the sac. This means the anterior lacrimal drainage system is patent. Soft stop, what does this mean? You could not enter the sac, either canaliculi or common canaliculi, somewhere that might be causing the obstruction. Soft stop.
Next slide, sir.
Then another Jones dye testing. Now, dye testing is indicated only in patients with suspected partial obstruction. Epiphora is present, but there is no punctal abnormality, and the patient tastes saline in his or her throat on irrigation. Now, the primary test. The primary test differentiates between partial obstruction of the lacrimal passages and lacrimal pump failure from primary hypersecretion of tears. What do we do in this? A drop of 2% fluorescein is instilled into the conjunctival sac of one eye only. After about 5 minutes, a cotton tipped bud moistened in local anesthetic is inserted under the inferior turbinate. And what are the results? Positive. When do we say it's positive? Fluorescein recovered from the nose indicates patency of the drainage system. Watering is due to, now, if fluorescein is recovered, this means watering is due to hypersecretion because the system is patent. So no further tests are necessary. But if Jones dye test is negative, then what do we do? No dye was recovered from the nose. So this will indicate either it's a partial obstruction or lacrimal pump failure. In this situation, secondary dye test is performed immediately. What is this secondary irrigation test? Topical anesthetic is instilled and any residual fluorescein washed out from the conjunctival fornix. Now the drainage system is now irrigated with a cotton bud under the inferior turbinate. Let us see what the results are. Positive. When do we call it positive? If fluorescent stained saline is recovered. So previously this was not there, but after drainage, after draining the system, we got some fluorescent stained material. So this says that partial obstruction of the nasolacrimal duct is there.
Pointer.
So negative. Now what do we understand by the negative test? Unstained saline recovered from the nose indicates that fluorescent did not enter the sac. So this implies the upper lacrimal dysfunction, which may be due to partial physical occlusion and pump failure. So thank you. We have selected the case and now over to the surgeon.